My name is Dr. Bessam Farjo, and I'm a hair restoration surgeon at the Farjo Hair Institute in Manchester and London. I qualified as a doctor, of course, and was looking to specialize in surgery. Actually, I was doing various general surgical specialties, and but not quite made up my mind what I want to do eventually. And I came across hair restoration surgery at the same time as I was going through male pattern hair loss myself. So it kind of triggered extra interest in it. And at the time, back in the early 90s, it was not as sophisticated as it is today, to say the least. So it kind of was of extra interest to be sort of at that stage looking at developing the specialty further. I was born in Iraq, and I grew up a mixture in Iraq and in the UK. As I said, I was born in Iraq, but when I was very small, my father was a surgeon as well, and we lived in the UK for several years while he was specializing, and I went to school in the UK and then went back to Iraq. So my background is mixed. In the field of hair restoration, it can be quite emotional at times speaking to patients. So the most rewarding thing for me really is when patients come back and seeing the difference what we do makes, not necessarily to the patient's looks, but in the way they feel about themselves. And sometimes they feel quite emotional, and sometimes it's quite life-changing. They change what they do. They change their attitude socially and relationships with people, and in what they say and what they write to you, you can feel the difference it makes. So that is the most rewarding, not really doing the surgery itself or the immediate after effect, but really the changes it makes to people's lives. My patients, when they come to see me, mostly say to me that they've come here because they trust that they're going to be told what they need rather than sold to. So they trust that we're going to say what's in their best interest, and that could mean that treatment is not suitable, or that they should wait, or that they're too young, or it's too early. And also they say that they approached us because they want their work to remain looking natural, subtle, what people expect. They don't want an artificial look. What I value most about my patients is that I find most of them have done a lot of homework and a lot of research. And I really appreciate the amount of time they've put in to come to the conclusion that coming to us is what they want to do. Our field is still evolving, and it's mostly in private medicine rather than NHS. So our challenges probably lie in regulating our field, but also most people who would like to enter the field find it difficult to find the right level of education and right level of training. I was fortunate when I started, my wife and I, who are both the doctors who founded the practice, we were able to start on our own because the size of the operations was small enough. But nowadays, people need quite a big team around them, and it's quite a challenge, both in terms of time and finance for a new person to start on a level or to make the commitment and do the quality work and without knowing where the patients are going to come from. So it's difficult for people to enter the field at the right quality, with the right quality, with the right amount of staff as well.